Hello, my name is Ryan, and I'll be talking about the vaccine Bacille Calmette-Guerin, otherwise known as BCG. This vaccine is used for tuberculosis, a disease caused by the bacteria Mycobacterium tuberculosis, which are bacillus bacteria coated by a waxy substance called mycolic acid. Mycolic acid gives the bacteria the ability to resist many antibiotics. A tuberculosis infection begins when a person inhales a fluid that contains many bodies of Mycobacterium tuberculosis. Some of the inhaled bacteria will go down the trachea and enter the lungs. They then multiply and eventually get detected by bodily immune cells called macrophages. A granuloma, which is a small area of inflammation, develops in the lungs after detection. If the granuloma is broken through by the bacteria, this means that a person's immune cells cannot stop the growth of the bacteria, and the bacteria is free to damage surrounding tissues, which causes the disease tuberculosis. The symptoms of tuberculosis includes a cough that lasts for 3 weeks, weight loss, a fever, chills, and night sweats. The bacteria can also spread to the spine and cause back pain, and it can also spread to the kidneys, which can lead to the presence of blood in the urine. BCG is rarely used in the US. This is because the chances for a person to acquire a M. tuberculosis infection in the US is quite low. In fact, in 2019, the rate of tuberculosis in the US was 2.5 cases per 100,000 people, which is the lowest it has been since that data has been recorded. Another reason the vaccine is not used is due to the fact that it can interfere with a tuberculin skin test, giving it a false positive. The tuberculin skin test analyzes the way the skin of a patient reacts when a small amount of tuberculin, a protein from N tuberculosis, is injected under the skin. BPG's mechanism of action is similar to most vaccines. It mediates immunity from the development of memory T cells, which can quickly react after a future infection from M. tuberculosis. Side effects occur in 1 to 10% of those vaccinated. The effects include prolonged ulceration at the vaccination site, lymphadenitis, which is inflammation of the lymph nodes, and lupus vulgaris, which are essentially skin lesions. The more mild symptoms include a fever and a headache.